Good evening. Happy New Year to all of our viewers there. My name is Diane Welborn, and I am the Ombudsman, and I'm the host for this evening's program. And we have a program full of information for you all tonight about our nursing home program and specifically a task force that was organized at the state of Ohio level on Nursing Home Quality and Accountability Task Force. So we're going to get into more details about that with our program director for long-term care at the Ombudsman's office, Chip Wilkins. So Chip, thank you very much for joining me tonight for this program.
Oh, Diane, thank you. It's great to be here.
Well, it's wonderful to get to hear information about this report, which is very full of good recommendations, and I think information that our viewers need to know. So again, thank you for coming. The Nursing Home Ombudsman Program or Long-Term Care Ombudsman Program has been around for a long number of years, since the 70s. And in our particular region of Ohio, we cover 9 counties, and that includes about 16,000 nursing home beds. And Chip will bring us up to date on the all the other numbers that the program encompasses. But it's a lot of people in nursing home facilities now, and definitely a lot to cover. So, Chip, why don't you introduce our audience to the task force, when it was created, how it was formed, why it was formed, and we'll take it from there. Thank you.
You bet. Well, I echo your sentiments and wishing everyone a happy new year and to you as well. Uh, the task force was kind of created almost a year to the day ago. It was in late January of 2023 that a report and ranking of nursing home quality of care throughout the United States. And so they looked at all of the states and the quality of care based on a myriad of different variables. But at the end of the uh, evaluation process, Ohio came out 38th in the country in quality of care. So
That's not where we want to be.
we do not. And we have too many uh, quality individuals working in the industry that it just could not sit right with most of us that the quality of care was so poor. And certainly the sitting and not doing anything about it was not an option. And in late January of last year, uh, Governor DeWine requested that a task force be created to work or address the quality of nursing home care in Ohio. And really, at that point, had to appoint a chair to that task force. And Ursula McElroy, who is the director of the Department of Aging, was assigned the dubious task of heading up this task force. And that all transpired by the end of January of 2023, that Director McElroy then put together a team of 12 individuals to form the task force. to come up with a plan to number one, identify the areas where we really do need improvement in Ohio's nursing homes, and then secondly, come up with actionable strategies that will lead to better quality of care in Ohio nursing homes. And the governor, not asking much, wanted the task force to have a report completed by the end of June of 2023, and uh, the recommendations to be contained in that report. So for 5 months, the task force, beginning in February, put together a series of meetings throughout February to come up with a game plan. And that is when specifically they decided the best way to get information about how care is lacking in nursing homes is to really go and have forums throughout the state of Ohio where the state will listen to the concerns brought by nursing home residents and families. And there were 8 listening sessions throughout Ohio. Um, really, it became such a welcomed event that if, for instance, there was a listening session, I believe it was in April of 2023 in the Dayton area, the response was so great to that request that there had to be a second session. So we had a morning session and then an afternoon session. And the task force did this throughout the state and really got invaluable information from residents and their families who came out to these meetings, which at many times became very passionate because individuals have uh, been at nursing homes and have seen what it's like at, not everywhere, but at some locations on late Sunday afternoon when there might not be all of the staff that you expect, and have had to endure that. And staffing, and we'll get to this in a little bit, that is the big issue in Ohio that we're facing. There is a labor shortage at the moment, particularly those that are trained in uh, either nursing or as an aide. But the state of Ohio completed their listening sessions and then uh, started the work of putting together the report. But it wasn't just the listening sessions. Of course, they looked at all of the data that comes from the Ohio Department of Health, who regulates and oversees the uh, nursing home industry in Ohio. And if there's a uh, complaint that the facility is somehow not in compliance with a either resident right or a law, they can get cited and suffer sometimes financial penalties. But in every case, they are going to have to put together a plan of correction so that whatever occurred doesn't occur again. So they looked at all of this data from the Department of Health. They also looked at data from the Ombudsman's office regarding verified complaints in nursing homes and what were the most common complaints, and really took all of this information and came up with recommendations to the governor as to how we can move from what may not be the quality care we want or have to the quality care that we expect and that our seniors deserve. And it's not just seniors. There are a wide variety of individuals in long-term care facilities. So that's a
Yes, thank
little
you.
overview, and each one of those we could have a program on.
Yes, that's definitely true. I think that last point is really important too. It's not only frail elderly that are in the facilities, but we have younger individuals who have a disability or a problem that for which they need round the clock care.
That's right.
Before we go forward, and there is a lot to talk about, we were 38 here in Ohio, which got everybody alerted. And can you share? Do you have information about what other states' response to this ranking has been?
I know that for Ohio, as well as the other Midwestern states, particularly Pennsylvania and Indiana, who were in worse shape than Ohio, that there were similar calls for some sort of reform of the industry, more the nature of the staffing concern and how to best address that from state to state, because you will typically find that there's a direct correlation between states who have difficulty staffing nursing homes and states that poor or score poorly on the ranking system. It is without a doubt the biggest factor that influences the positioning on that ranking. But I think, Diane, that really most of the states are first trying to look at the staffing issue and what strategies can be put in place to help that uh, and really bolster uh, the staffing pool of individuals, because really right now there was a study in 2020 that there were 2.8 million individuals over the age of 60 in Ohio. They project by 2030, 10 years later, that's going to be close to 4 million over 60 in Ohio. And so if we're having difficulty now staffing to care for our senior or our long-term care residents, the problem's not going to get better. It's actually going to get much more challenging as we have more and more individuals needing long-term care.
Yes, thank you, Chip. That's definitely going to be the case at that kind of rate of increase. We are a state, as many in the United States, that is aging, and that's showing there. I wanted to let our viewers know that this is a call-in show, and while we don't take calls directly while we're on Zoom, you can call DATV and the numbers on the screen and put your question to us that way. And so we have our first caller this evening who asks something related to what Chip just mentioned. When the study was done, what did they find was the most important factor to the low quality of care in our region? So I'll let you respond to that, please.
Thank you. Great question, and it really uh, zeroes in on what we were talking about. The most important contributing factor to low quality of care is diminished staffing in the facilities. or not enough staff to meet the needs of the residents. In Ohio, there is uh, a law, a rule in effect that every nursing home must staff the facility in such a way that they can meet the needs of each resident. However, as a floor, the state says that you must have enough staff to provide 2.5 hours or 2.5 hours of direct care per day per resident. So each resident should be interacting 2.5 hours per day with staff, and that is a minimum. The federal recommendation is 4.1 hours of direct care per day. So Ohio at 2.5, you would hope that we would be able to easily meet that direct care requirement. Unfortunately, there are many facilities who are still unable at times to meet that 2.5 hours of direct care per day.
Yes, and I think that many of our viewers, particularly any of us who have cared for loved ones who need that type of care in their homes, with 2.5 hours a day of care is just does not meet the need. It's just not enough. So I'm not sure exactly how that got determined through our legislative process, but it 2.5 hours a day for a person that needs assistance and is living in a nursing home is just simply enough. Um, the next caller that we've had already is asking where a person can get access to this report. Thank you for that question. We were going to reveal that to you. I'll toss it back to Chip and for the website. It is about a 18-page report, but that also includes a lot of pictures and a lot of quotes, which are interesting. And so I think our viewers will want to take a look at this. So, Chip, where is this recommendations report available, please?
Sure. The task for task force report can be obtained a couple of ways. One, you can go to the Ohio Department of Aging and obtain you can actually download the report. What you can also do for those that are a little more computer savvy, you can go into your favorite search engine and type in Ohio Nursing Home Task Force. And I have found about three different sites in their secondary servers where they also currently have the task force report. But Department of Aging at age.ohio.gov is the best place to obtain a copy of that task force report and recommendation.
Probably the easiest as well, just to go to
True.
them. Yeah, just to go to them directly. We have so much more to talk about, but in this report, some of the things that we in the ombudsman's office found distressing is comments like I'm quoting here from page 11 of the report that submitting a complaint is like dropping a piece of paper in the ocean and hoping it gets to the right person. So, our hearts sink when we read that because our phones are busy all day long. and all weekend long and all night long, and which we get the next day of people that are lodging their complaints. So, but this particular person felt like, it's like a message in a bottle, and you don't know on the ocean where it's going to end up and where it's going to go. And then other types of complaints, other types of comments that came from families of residents who are, of course, most involved in their care, is that uh, one is the process of getting help is so difficult, it's exhausting. And she just writes that she wants to just be the daughter. And it's a second commenter says that it feels like you're signing your life away when you fill out those forms, meaning to enter a facility, and you are. And then a third comment states, I'm an attorney and I was confused by the paperwork. It shouldn't be this difficult. And lastly, but probably most important, is that one person commented, I'd never heard of residents' rights until this listening session. So that's a lot of educational challenges for us to do, despite being busy day after day after day, that many people just don't know anything about what the rights are of people who live in long-term care facilities. And we have a long way to go to bring that up to speed. Do you have any response, Chip?
I do, Diane. Those are very disturbing complaints that we hear. Disturbing in that there's not a, or there has not been an effective campaign in Ohio yet where there's education about resident rights and about ombudsman, as well as the Department of Health, because folks go into nursing homes typically not knowing much at all about long-term care in the industry, and they are immediately aware of the fact that they are a tiny, tiny fish in this big pond, that they have no knowledge of the surroundings because it's a totally new world. They use different language. There's lots of interaction between insurance and Medicare and Medicaid. And the process of billing, the process of planning a regimen of care really takes the forefront at the beginning, and they never seem to uh, educate the residents as to ombudsman, as to resident rights. That's something that we are going to try and improve. And as a part of the task force recommendation, they are going to try and increase the presence of ombudsmen throughout the state of Ohio to make sure that that message is getting out to the residents, that there's what we call a regular presence by the ombudsman at a facility. And I'll give you an example. We have in Dayton, which is the hub for a 9-county region that we work in, and we have a little over 16,000 beds, over 200 facilities, and that's both nursing home and assisted living. But we, for years, only had 2 or 3 ombudsmen in the area to cover that. That did back in 2020 increase, and fully staffed, hopefully we'll be able to get 4 or 5 now ombudsmen into facilities. And again, we're just one region. There's 12 regions in Ohio, and each region has its own ombudsman staff. So we are really going to try through this task force report and recommendation to increase the ombudsman regular presence. And in doing so, we will be able to hopefully reinforce to residents that they do have rights, that it's explained, but also, and maybe more importantly, in some cases, we'll be able to make sure that nursing homes and all nursing homes are really following the rules and prominently displaying resident rights in the facility. That's supposed to be almost poster size in the building and something that no one can miss. And uh, also our contact information. If a resident has a concern, they should be able to contact an ombudsman, and that information will be displayed. But also, with the task force recommendations, there are going to be more Department of Health surveyors, and we call them surveyors, but they are the ones that actually go out and uh, gather the facts and evidence on complaints that may result in the facility receiving a citation. And I guess now's a good time. It's important to uh, distinguish between the Department of Health and the Department of Aging and our different roles. Now, the ombudsman's independent, but we have to be under one of the Ohio umbrellas, so they put us under the Department of Aging. However, we are not a entity that comes out and cites a facility. That's what the Department of Health and their surveyors do. We come out and try and resolve whatever the problem is. We try and communicate between the facility and the residents many times and work to get a solution, not just for that one individual, but for all of the residents in many cases. So if someone has a complaint because they've received well, we just had one where they only had one shower in a month, and this particular resident was to have three a week. The the resident contacted our office. A family member of the resident contacted the Ohio Department of Health. Department of Health came in and cited the facility. There's a fine associated with that because they were able to see for the last 2 months, that the resident was not being showered appropriately. And we came in then and worked with the facility to create a better system for tracking their residents' bathing schedules and making sure by following up that they are following through with that. So really, as part of this task force, the influx of more ombudsmen and more surveyors will address one of the key components of the report, and that is that there needs to be tighter oversight of the facilities because the volume of complaints is just so loud at this point. I mean, there's so many complaints coming throughout the state that this needs to be done, the oversight. But then another end of the task force recommendation is really to come in and put in strategies to try and improve staffing. So that's just a little response, I guess, to the complaints, and we know how desperate it is for some individuals that are in nursing homes a lot for the first time, and not knowing where the world that they're in, and the best lifeline really for residents who feel like they're they just don't know the system, is to contact us, because that's a big part of what we do in educating and really being there for the individual as an advocate, because a lot of times they don't know what they have the right to advocate for.
Exactly. And thank you. I'm going to circle back just a little bit
Sure.
on your wonderful response there to say to the viewers that we accept almost every invitation to speak to groups about residents' rights and what they are. And so we are available to help educate civic groups and church groups and any group basically about what residents' rights are. And until families have a person that's living in a facility, this is just not something that really crosses their mind. It's not of importance or relevance to them. And we also have an active program of educating staff in nursing homes about residents' rights, many of whom have not obtained this information about residents' rights in their previous training. They may have received training in nursing care or in personal care, but not necessarily the residents' rights. And one last thing I'll add on that before we move on is that when a person enters a nursing home, there's a nice, stack of material that they are asked to sign and saying that they understand what they're doing and they understand what this is all about. And residents' rights is in this packet. But is it read and understood? Not usually at the time, because it's usually somewhat of a traumatic transition for a person to enter a nursing home, and this is not what they're thinking about. So there's lots of room for our advocacy, and just want to also say that we have a very active volunteer program, and we train our volunteers from our staff at the Ombudsman's office in Dayton. We train them in advocating for residents' rights, and they can go out to facilities, talk to people, and then bring complaints back to our staff. Or if it's a more minor complaint, they can handle that themselves. So volunteers are a very integral part of our program because we just don't have enough money to have enough ombudsmen full-time on staff to send out to all the places where we need to be. So the volunteers are really a lifeline for us. Now, I wanted to come back and talk a little bit more about the role of the Department of Health, but we have another caller, and this caller is asking if we can describe what happens when somebody calls our office to make a complaint and what is the time frame for a response. That's a very good question, and I thank the viewer for calling in about that, because we do have fairly strict time restraints on how we respond because people are in need. So take it away, Chip.
Thank you. Absolutely true. We try and respond to every complaint. And when you call our office, more often than not, you're going to either leave a message directly with the ombudsman or the individual ombudsman who's doing intake that day. But we always, and I will say we try to always call back the same day of a call, but certainly within 24 hours. And then we go through the process of taking down information about the specific complaint. Then we open a case within our office. And once we do that, we have 5 business days to try and get to the individual to meet with them face to face. Now, in reviewing our data, we typically are there within about 3.5 business days. We're doing a little better than average right now. But again, we'll be there and meet within a 5-day period. And during that meeting, we'll come up with together, working with the resident and their family, a plan to try and resolve whatever the complaint is. But typically, at the end of that first meeting, there is a game plan with specific dates when certain things are going to be achieved. And a lot just depends on what is the nature of the complaint. For instance, I had one today with someone who is at a hospital, and they went from a nursing home to a hospital, and the nursing home that sent them to the hospital is not agreeing to take them back. And so with that case, time is of the essence. And so we were able to address that kind of urgently, and it was all done in a day. Whereas in the facilities, it may take a few days to get there and then get it resolved. But the time frame and turnaround is quick because the complaints are time sensitive and important.
Right, right, exactly. Now, there were approximately 20 individuals representing different parts of the nursing home industry and the residents on this particular task force. And one that's very important for Ombudsman is the Department of Health. And you touched on that earlier, the fact that ombudsmen go in to advocate for residents and to resolve complaints, but we don't carry the hammer of enforcement to fine anybody, and that's what the Department of Health does. So can you say a little bit more about when should a person call our office, and when should someone jump to calling, as people often say to me, the state, meaning the Department of Health?
Absolutely. And it's a great question. And I always err on the side of calling our office first, because many times that someone calls with a complaint, we already are working on that same issue within the facility. And we will then work with that caller as well. But the if there is an issue that really needs to get resolved, and the sooner the better, you really do want to contact our office, because the Department of Health will, and they are wonderful, but they will come in and cite the facility if they find there's evidence of a violation of one of the rules. But they are not going to necessarily try and fix the issue. They expect that it will be fixed, and that they call it a plan of correction, will be followed. But that is really secondary to finding the facility either in violation of the rules or in compliance with them. So if it is something that needs to be resolved, and you want it resolved in a timely manner, always contact the ombudsman's office. Even if you do contact the Department of Health down the road, we are going to be there trying to solve the problem, because that's what we do as advocates. We don't just say, how dare you? We actually try and come in and fix whatever the issue was.
Thank you. Appreciate that. We've had a couple of other calls come in, so I'd like to certainly deal with answers to those. You have mentioned that many, if not most, of the complaints we receive have to do with a lack of staffing or inadequate staffing in facilities. And one caller has written in or called in, what can ordinary people do to advocate for an increased level of staffing in nursing homes? So, what are options that you can present to our viewers about what can they do?
Great question. These are good questions tonight. They're always good, but these are extraordinary. I would say that the really the average citizen has first and foremost they need to be aware of what are the requirements in nursing home for staffing levels, which you, if you're watching now, you know it's 2.5 hours per resident per day. But how does someone know if the facility's complying with that? Well, I will tell you that every nursing home is supposed to prominently display the staff to resident ratio for that day. And so if you go in on a Tuesday to a nursing home, you can ask if you don't see it right when you walk in their lobby area. You can ask what their staffing ratio is or where is it posted, and it will tell you that they have 8 nurses and 15 aides working, and that there are 88 residents. And so you can do a formula and come up with the number of direct hours, and that will be highlighted. And it may be 2.7 hours that's displayed there, but it's in the facility. It should be posted. If it's not, ask for it and ask them why isn't it posted, because it is by law supposed to be. And believe it or not, most facilities have that displayed. Every now and again, we will find that, you know, it's 2 days old, and we'll ask them to update that. So that's number one. Know the law, which you do, and make sure you verify that it's displayed and get an idea of what the staffing is. Secondly, you are the strongest advocate as an individual for increased staffing hours by contacting directly your legislature, whether it be a congressman or a senator. This is where grassroots contact with your representative is so important, because there are folks within the ombudsman world lobbying to try and increase the hours of direct care per day. But there are also industry lobbyists who are coming in trying to keep it where it's at or even lower it. And so it's important that everyone who feels passionately about the staffing requirements to talk to your legislature. I mean, the federal law is there's a proposal to require 3 hours of direct care per day per resident. And in order for states to qualify for Medicare, they will need to comply with this. Now, we thought that it was going to take effect within the 2-year window from when it was first introduced, but there's a lot of pushback by uh, folks who don't think that the increasing of the hours is going to make a difference because they can't field the needed staff as is. So you're going to go and put more hours on us and set us up to fail. I mean, that's the argument we hear quite a bit. And I think that's where the task force was really uh, clear on saying it's not just about increasing staffing, it's how you do that. It's working with the colleges, with uh, the 2 year groups or 2 year community colleges, with high schools to try and get both aides and nurses directly coming from their educator into the industry. It's also incentivizing the industry to perform at a higher level, and if they are able to meet certain milestones or goals, they will be eligible for either bonuses or increased reimbursement rates. But to tie the increase in any kind of reimbursement to the work that has been seen in the nursing home. So there's a lot of different ways to tackle how you go and increase staffing, and the average individual is able to really light a fire under their congressional representatives so that they know when they go to vote on this at some point in time that their constituents that they're serving are in support of it.
Right, and that they're watching, and
That's right.
they're watching what the vote, how they're voting on these different issues and the importance of staffing. One of the questions that I have had many times over the years is, what facility would you, as an ombudsman, Diane Welborn, choose for your parent, should they need to enter a facility? Well, which really leads to a question another caller brought to us for the program is, do we rate facilities based on the complaints that we've received? So I'll let you address that, and how can people find out if they have time, if they're not in a crisis, if they have time to investigate different facilities. Maybe you can describe how that can take place.
Absolutely. You know, the currently in Ohio, we have what is called the Long-Term Care Consumer Guide, and believe it or not, it's at the Department of Aging
Yeah.
at age.ohio.gov. But the Long-Term Care Consumer Guide in Ohio is a tool that allows anyone to go and see what nursing homes may be in their county, but it can be by zip code, it can just be by name, but you can look up every nursing home in Ohio, and then you can see what the complaints have been about at that facility. You can dig into the reports that are there. It is a little cumbersome at first because the design is about 10 years old now, and technology has improved quite a bit. However, part of the task force recommendations is to update the website. And really, they had during COVID, the state of Ohio created a dashboard that laid out a lot of different complicated data in a relatively uh, easy to understand interface. And they're going to try and do the same thing with the Ohio Consumer Guide to make it more user friendly. And so you can directly see what are the complaints for the last 12 months that the Ohio Department of Health has cited the facility for, and how many residents are at this facility, how many beds do they have, what is the response from families and residents during what are called satisfaction surveys. Every other year, there is a resident satisfaction survey. And when there's not a resident satisfaction survey, there's a family satisfaction survey. But you can pour through those surveys, even the ones for the facility you're researching, and see what other people are saying about that facility. And all of this is found on the long-term care consumer guide. And it is by far and away the best tool that is out there on the internet to review facilities. But you can also put up to 5 facilities at one time across your screen and compare and contrast their data. And it's a really helpful tool, but it needs a refreshing. And that is part of what the task force has recommended, so that you can get data from other agencies as well that will be helpful in making the best decision for your loved one. So, but our data, it's really right now the only way you can know how many verified complaints have we had at Jane's nursing home. You have to call us, and we can tell you that. Hopefully, that will be on the consumer guide, but we do not rate facilities based on the number of complaints or verified complaints or the data from the Department of Health. That is not something that we do. You can go to Medicare.gov and Nursing Home Compare, and there's an ability through that site to look up nursing homes in Ohio, and there is a star rating, but none of our data is part of that I'm aware of.
Right, right. Well, thank you for that. And I just do want to stress that if anyone viewing the show is trying to look at these tools, that staff in our office are certainly ready to assist with that. But I would also just add that there is really no substitute for actually visiting a facility and seeing what it looks like, talking to people about how they feel about living there, about what it looks like, about what the food looks like, about how it smells. There's just a whole range of things, but actually visiting in person is probably something we recommend very highly, but we're happy to help people in making a selection if we can. Chip, we're coming up on the end of our time. So we're going to have to close very soon. But before we do, I would like to thank you, and I'd like to give you the opportunity for any final comments or any that I have not asked you about tonight.
No, the right now in Ohio, we're at a pivotal point because we know we're not able to currently meet the needs of nursing home residents like they deserve and should be receiving care. And that number of nursing home residents is only going to increase. And I'm just thankful that we are at least in a state where they're taking this issue seriously, because if there wasn't some plan in place to address it, it's going to be our families who are suffering, or you're someone you know. So it's important, and quality of life is very important, and no one deserves to have a substantial quality of life than our seniors.
Thank you so much, Chip. I really appreciate that. And if any of our viewers have questions about anything that's been said tonight, we are at 937 223 4613. So give us a call and we will definitely call you back and get you the information that you need. So thanks to the viewers for watching this evening. And thanks to the people who called in and gave us their very excellent questions. And again, appreciate it. And thank you, Chip.
Thank you.